imagine spending years developing a generic peptide drug, passing bioequivalence, clearing toxicology, and then Health Canada or US FDA comes back and says, this isn't enough. That happens, and if you don't know why, this video could save your next regulatory submission. Hi, I am Raghuveer Singh Parmar, Director Scientific Affairs at Resolve Mass Laboratories Canada. Resolve Mass Laboratories stands at the intersection of analytical excellence and complex drug development, helping pharmaceutical teams overcome critical challenges in peptides, impurities, and regulatory pathways. So, here is something that catches a lot of companies off guard. When you are developing a small molecule generic, bioequivalence is the gold standard. You run a PK study, you show the plasma concentration curves, overlap, and you are largely done. Simple. Peptides don't work that way. Peptides are complex, they have tertiary structures, disulfide bonds, post-translational modifications, and critically they have impurity profiles that can behave very differently from batch to batch. A single deamidation event, a truncated sequence variant, these aren't just analytical footnotes, they can meaningfully affect safety and efficacy. So regulators, including Health Canada and US FDA, have a fundamentally different ask for generic peptides. They want sameness, not just equivalent absorption, structural sameness, chemical sameness, and impurity level sameness. And that is a completely, I would say, different kind of analytical problem or different kind of analytical study. What does a peptide sameness study actually involve? Let me walk you through the core pillars because each one has a purpose, and skipping even one pillars can derail your entire. First, primary structure verification. This sounds fundamental and simple, but it's where the work begins. You need to confirm amino acid sequence of your drug, every residue, every disulfide linkage, using high resolution mass spectrometry. Intact mass measurement via HRMS tells you the molecule is broadly what you expect. But then you go deeper with LC-MS-MS fragmentation. You're literally sequencing the peptide, confirming the exact arrangement of amino acids, and catching any truncations or sequence variants that might have crept in during synthesis. Second is about peptide mapping. This is your structural fingerprint. You take your molecule, digest it enzymatically, typically with trypsin or glucine, and run it through LC-MS. The goal is 95 to 100% of sequence coverage of each fragment. That means every single segment of your peptide has been detected and confirmed. And you are not just doing this for your drug alone. You are running in side by side with the reference product, comparing chromatograms and showing they are really equivalent. Third, that's impurity profiling. This is where many companies underestimate the challenge. Process-related impurities, synthesis byproducts and residual reagents, and degradation products from oxidation or deamidation all need to be characterized at low levels. And we are talking low, often sub 0.1% relative to the main peak. You need UPLC and LC-MS-MS working together with validated methods that are sensitivity, optimize, and stability indicating. Now, understanding the science is one thing, and understanding what regulators actually want is another thing. So that's the dossier or regulatory submission. Health Canada or US FDA is very specific. They want side-by-side chromatograms comparing taste and reference. They want stability indicating methods and forced regressions data, meaning you have deliberately stressed your molecule with heat, light, acid, base and oxidizing conditions, and you have shown your methods can detect the resulting degradants. And of course, everything must come packaged in submission ready technical reports with fully validated analytical methods. This is where many developers hit a wall. The science might be solid, but if the documentation doesn't align with what the regulator expects to see, structurally, linguistically, in terms of method validation parameters, you are looking at clarification request or outright rejection. One thing I see constantly in this space, companies underestimate the challenge of separating co-eluting species. Two peptide fragments nearly identical mass and retention time can be almost impossible to resolve without the right column chemistry, right gradient condition, and the detection strategy. And isobaric peptides, molecules with identical nominal mass but different sequences, require MS-MS fragmentation patterns to distinguish. These are not textbook problems, they require hands-on, method-specific, really problem-solving skills to implement. I want to talk briefly about kind of work, what actually makes or breaks these studies. Because at Resolve Mass Laboratories, this is exactly the type of challenge we live in almost every day. We had a project recently involving a cyclic peptide with multiple disulfide bonds, notoriously difficult to characterize because the digestion patterns are unpredictable and resulting fragments often don't behave like linear peptides. The standard workflow simply wasn't achieving the sequence coverage the regulator required. We had to develop a multi-enzyme orthogonal digestion strategy, combining trypsin with ASPN and running different pH gradients before we got to full coverage. That's the kind of method development that can take weeks if you don't have deep LCMS expertise in-house. The point isn't just that we solve it, it's that this work requires the orthogonal methods by design. No single technique will give you everything you need. Orthogonality isn't a regulatory checkbox, it's the only scientific approach that gives you confidence your answer is real. So let me leave you with a few practical insight you can take away from this session as we discussed few points on sameness study. Number one is don't conflate bioequivalence with sameness. For peptides, you need both, but sameness is the analytical complex one and it needs its own dedicated strategy and expertise. Number two, invest in method development early. The analytical methods you choose, the column, the digestion protocols, and the detection platforms will determine whether you can detect what you need to detect. This isn't the place to cut corners or rely on generic workflows. Number three is plan your documentation in parallel with your science. Regulatory ready means knowing what format, what comparison, what validation data the submission package needs before you start generating the data. Not after you finish your data generation. Number 4 is orthogonal methods, which are not optional. If you are using only one analytical approach, you don't have full confidence in your characterization. That's it. Peptide sameness studies are genuinely complex, but when they are done right, they tell a complete structural story that regulators can trust and finally approve the project based on that. And that's the goal of any peptide projects. So if you are navigating a generic peptide program and have questions about study design, method development, and what US FDA or Health Canada is actively looking for in your dossier, I'd love to have that conversation. Drop a comment, reach out directly, or connect with the team at Resolve Mass Laboratories, because at the end of the day, this science deserves to be done well for peptide projects. Thank you so much for watching this session, and see you in the next one. Goodbye for now.